there's a lot of circumstances where a woman has a little bit of spotting, a little bit of bleeding, a little bit of cramping in the first trimester. That is always concerning. People panic. What is going on? What is happening? Am I losing the baby? That is always the concern. So you have two options if that happens. If the bleeding and cramping is mild, you can wait till your doctor's visit or next day appointment, which most OBGYNs allow you access immediately. Like if a patient calls me and says, hey, I'm bleeding, I'm gonna be like, come in, there's an ultrasound, let's see what's going on. The second option, if you're panicking, is to go to the emergency room. That's not always the best option. The emergency room will give you an update right away. They'll do an ultrasound, they'll do some blood testing, they'll tell you your baby's viable or it's not viable. But it's at a huge cost. The cost of an ER visit could be in the upwards of $3,000 or more. So, especially considering with all the plans and everything else that's going on. So think twice about going to the emergency room for spotting or bleeding lightly in the first trimester. Now, God forbid you're hemorrhaging out and you have a severe vaginal bleeding episode, then you might miscarry. In that case, you need to go in and be evaluated. So please don't delay. I mean, if it just happens and it's 5 o'clock in the morning and you want to come see us, your OBGYN, we will take you, we'll take care of it. And if we need to do something, then we'll send you to the hospital. But if that happens during the night or during the weekend, again, light bleeding, it's better to wait till Monday or the next day. If it is heavy and you think you're miscarrying, then you get a faster, quick answer immediately into the ER. Sometimes you can do an urgent care visit. They don't have gynecologists at the urgent care. They don't really do ultrasounds. And if you're in the first trimester, they don't always do the fetal heart tones to try and get the fetal heart tones. They're not very adept at doing that when you're 9 weeks pregnant or 8 weeks pregnant. So women tend to panic. There is a 15% chance that there is a miscarriage with any pregnancy whatsoever. That doesn't mean you need to worry about it. It happens rarely. Again, 1 out of 6. It's pretty common if you look at the big picture, but it's pretty rare. The chances are, even if you bleed lightly, that is still a normal pregnancy. And you can get reassured the next day when you see the doctor in the doctor's office. Yep, your baby's alive, looks good. I see a little subchorionic hemorrhage. So what is the subchorionic hemorrhage? Well, a little bit of bleeding happens. So your uterus has the sac in between. It's attached to the uterus. And there's a bleed between the attachment of the gestational sac and the uterus. So that's a subchorionic hemorrhage. It usually resolves. And I've had a patient recently that just came back a week later, and she really, we detected a little spotting. She came in, we saw her the next day, and she had a pretty large subchorionic hemorrhage, about 3 centimeters. It went away by the next week. The baby is growing. The baby's still viable. She was about 6 weeks something. Now she's 7 weeks something. So baby is growing, still viable. So a lot of these cases, there is no need to panic, to call the ER, to call the hospital in the middle of the night. Yes, any bleeding signifies something happening that's not always positive. But it doesn't mean we need to panic. Stay put, be patient. Don't do any hot showers, hot sauna. Don't do any crazy activity. Just take it easy until you see the doctor. And again, light to moderate bleeding, the ER will do nothing. They might call the GYN on call, and if you do have a fetal demise, they'll say, hey, you have a fetal demise, go see your doctor. So now you have to wait to see the doctor and decide what the next step is going to be. So I'm not saying that you should not go to the emergency room if you feel like that's something that you need to do and it's on your agenda and you need to know right then and there, then feel free to do that. But in most cases, probably 99.9% of the time, if you have light, moderate, not crazy bleeding, it's best if you wait, call your gynecologist. Now, if you have the kind of gynecologist that doesn't answer the phone, that's a problem. So what I tell you to do, what we do in our case, walk in. Sometimes we're crazy busy. We have 8 phone lines, and I have 3 cell phone lines, and we're still slammed. So walk in, and you say, hey, I'm bleeding, and we know everybody who's pregnant, and we'll take care of you, okay? So you don't need to worry about not being seen. Now, if you start bleeding after 5 o'clock and the office is closed, and it gets worse and worse and worse, then yes, maybe you do want to go to the emergency room if you can't wait till the next day. Unfortunately, this is the thing that I want you to take away from all this. If there's going to be a miscarriage, neither myself nor your gynecologist that is seeing you or the ER will do anything to stop it. If you're lightly bleeding, I usually check progesterone to make sure that the progesterone level is good. And if it's low, I supplement progesterone. It doesn't matter the gestational age, your previous pregnancy loss. I'm not going to be like, oh, you lose a baby, then I'll give you progesterone. I mean, like, your pregnancy is special to you, it's special to me. So we're going to do the best we can to make sure everything is perfect. So I do recommend testing progesterone level. The ER won't do that. The ER will check your HCG, human chorionic gonadotropin hormone, which is the pregnancy hormone, and it doesn't matter what your pregnancy hormone is, one measurement. We need to see what happens to it in 48 hours. So it either goes up, it should rise by about 60% in 48 hours minimum. However, with lots of pregnancies, it doesn't rise by 60%, they still end up being viable. So we have a much wider umbrella of saying, yeah, this is not a viable pregnancy. Then we'd rather wait, make sure, explain to the patient, these are the findings, and this is what we can do. So the ER has a PA, most likely, that's going to end up seeing you, or an ER physician. They have minimal training and exposure in how to deal with threatened AB or first trimester bleeding, other than just checking your blood for the pregnancy hormone and doing an ultrasound, ordering an ultrasound, and then giving you the results. So long story short, it's best to have your OB doctor handle the problem if possible and not panic, because a lot of these pregnancies end up going to term completely. And very rarely there is the chance of losing the pregnancy with threatened miscarriage, like with the bleeding in the first trimester. I've had a patient recently that came in and had blood in the toilet. And it was only when she voided, one time. No blood on the pad otherwise. So probably some random inflammation of the bladder that caused what we call hematuria, blood in the urine. But she panicked. She's like, oh my God, I'm having a miscarriage. So she called her HMO doctor, who says, yeah, we'll see you in 3 weeks when your appointment is. She's like, oh my God, well, I'm not going to wait 3 weeks. So she found me on a Sunday afternoon at 6 o'clock. I answered the phone. So I said, no worries, come Monday, we'll take care of you. So she called Monday, she got in, we did an ultrasound, everything's fine, the baby's beautiful, 9 weeks. And we tested her urine and we gave her some antibiotic for the bladder infection. So just to give you an idea, it's not always a threatened AB. Sometimes it could be just something simple as bleeding from the urine, from the bladder, because you have a UTI. So long story short, your friendly OBGYN is probably going to be your best and first resort rather than just run to the ER. The ER is also understaffed and overworked, so you're probably going to have to wait hours to get seen in an environment that's going to stress you out even more. That's probably not going to be good for the baby. Sitting on a chair for 4 hours waiting to be seen when there's a bunch of other things, you know, other people coughing and spitting, you know, and doing all kinds of things in the waiting room. So I hope this was useful, because we had some requests to talk about this, and I've actually seen quite a few cases of threatened abortion, which is first trimester bleeding in pregnancy. And this is something that frequently we handle when we are on call, when I'm on call or other doctors are on call for the ER. They just call and we tell them over the phone what to do. But again, at this point, consider going to your doctor, waiting to see your doctor, and we can do an ultrasound right away. My office draws blood right away. We get the results sometimes that same day or the next day. So don't panic. The outcome is really very favorable. Very few patients actually end up miscarrying. Most of the time, it's a favorable outcome, and there's no need to panic.